In this lecture at Medical Sciences, we want to discuss about anemia, introduction to anemia. And you can ask yourself, what is anemia? Anemia is a condition characterized by low levels of hemoglobin concentration or low red cell blood count or low hematocrit levels. That is what we can talk about anemia. But by functionality, anemia is due to reduced red cell or what we call oxygen carrying capacity. So that's why we are seeing that under definition it is reduced HB concentration or total red cell or hematocrit or reduced oxygen carrying capacity of red cells. So that is what we are going to discuss in this video. Then after we shall look at the signs and symptoms of anemia. We are going to see causes, then classification, then we shall end up expounding more on morphological classification of anemia. And as we begin, we remind you to subscribe if you haven't subscribed, so that you are always notified whenever we release our videos. And remember to like the video and share the comments. So after looking at the definition, which is reduced HB concentration or total red cell count or hematocrit, depending on the sex and age of the patient. We're going to see in male HB concentration is always the lower cutoff is 13, in the female it is 12, in the pregnant women 11, and in neonates it can be below 14. Depends, so that's why we say it depends on the age and the sex. Then the signs and symptoms of anemia. How can you tell that someone has anemia? They are what we call general signs and symptoms and specific. And under general signs, we are going to see signs like palpitations. Palpitation is hearing this heartbeat without touching on the chest, but you hear the heartbeat. Then we are going to see paleness or pallor of the mucous membranes, like eyes, like lips, like the skin can become paler. Then under the general signs, we can also see general weakness, body weakness. Then we can also see headache. Someone having constant headache, having palpitations and paleness of the skin or the mucous membrane. Those are the general signs. Then among the specific signs of anemia, we can find jaundice, whereby jaundice, this is yellowing of the scleral membranes. So you find someone's upper part of the eye is yellow, or you find the whole skin is yellow, or the lips are yellow. That is what we are calling jaundice, due to increased bilirubin, characterized by increased destruction of red cells seen in hemolytic anemias. Then we shall see another condition like koilontia, which we call spoon-shaped nail. And this one is seen in iron deficiency anemia. Then we can see stomatitis. That is breaking of the angles or the corners of the mouth, which is majorly seen in megaloblastic anemia. So these are some of the signs and symptoms on how you can know that someone has anemia or reduced oxygen carrying capacity. After that, we want to see what causes this anemia we are talking about. And the causes, they can be either nutritional causes, it can be infections, and these infections can be acute or chronic, depending. Then we can see it under inherited disorders like hemoglobinopathies. Then we can see it in obstetrics, complications like during pregnancy. We can see it being caused by certain chemicals or what we can call drugs. These are some of the causes of anemia. And under nutritional, we can see iron deficiency can lead to that. Vitamin B12 stroke folate deficiency can cause anemia. Deficiency of proteins, protein deficiency plus vitamin C. So whenever someone is deficient of these nutritional factors, they can develop anemia. Then infections, we can see parasitic infections, someone having parasitic infections, someone having a bacterial infection, and someone having viral infections. Under parasitic infections, we can see examples of hookworm infestation, we can see tapeworm, we can see malaria. And under bacteria, we can see like Mycobacterium tuberculosis can do that. Then under viral, we can see HIV, stroke AIDS causing anemia, depending on the stage. After looking at this, we are going to see inherited disorders like hemoglobinopathies, such as sickle cell and thalassemias. So sickle cell disease and thalassemias can also lead to anemia. Then under obstetric complications, these are complications during pregnancy that are due to loss of blood. So these ones and these conditions can lead to anemia, and certain chemicals can also lead to anemia, like even someone on treatment of zidovudine. This zidovudine is an antiretroviral drug which is known to cause bone marrow suppression, and even anti-cancer drugs, not forgetting anti-cancer drugs. Anti-cancer drugs also causes bone marrow suppression, which bring about anemia. So these are some of the causes of anemia. So after looking at the causes, now we are going to look at how can we classify anemia. And there are only two ways how we can classify anemia. That is classification by etiology. What does etiology mean? Meaning classification according to the cause. Then the second one shall be morphological classification according to the size and the appearance of red cells. And under etiological classification, which we shall expound more in another video, we shall see that etiology can be due to either increased blood loss, increase in the blood loss. This one is seen either in acute or chronic bleeding. So so long as someone is bleeding, either it can be acute after maybe having a road traffic accident or having trauma, or chronic when someone is bleeding due to maybe hookworm infestation, or maybe someone is having menorrhagia, that is prolonged menses. So they can also develop this anemia due to blood loss. And this type of anemia, we call it hemorrhagic anemia. So this is what we call hemorrhagic anemia due to blood loss. Then another subsection under classification of anemia by cause is impaired production. Impaired production of cells. And under impaired production, there are many causes, and these causes can either be, the causes under impairment can be either nutritional, they can be either due to bone marrow suppression, like aplastic anemia. It can either be due to, there are many factors we can see which impairs blood production. For example, deficiency of iron, deficiency of vitamin B12, deficiency of vitamin C, we see it causing anemia. Then bone marrow suppressions like aplastic anemia can do that. So these are anemias due to impairment of blood cell production. And there are many factors. Then another third one where we can categorize under etiology is hemolytic anemias. Hemolytic anemias. These anemias, they are due to increased destruction, of cells. And these anemias due to increased destruction, or what we call hemolysis, they are also part of etiology, whereby these can be either intrinsic, or you can call it genetic, like hemoglobinopathies, like thalassaemias, red cell membrane defect, as we shall see them. Then they can also be extrinsic. They can be extrinsic, or what you can call acquired, or you can call them intravascular. Here we can see blood incompatibility, blood transfusion incompatibility, we can see red cell destruction, and so forth. So this is under etiology. So under etiology classification, it is either increased blood loss, we are losing much blood than what the bone marrow can replace, or either there is impairment in the production of cells due to either nutritional deficiency or bone marrow failure or any other causes like chronic diseases. Then the third one is hemolytic due to increased destruction of cells. Here the red cells are being hemolyzed before they reach 120 days than what the body can compensate. And we have seen they will be categorized under intrinsic and extrinsic, as we shall explain them in the coming video. So in today's video, we want to go on the second classification, which is the morphological classification. And this morphological classification, we are going to talk about it in details. Then in the next video, we shall also explain more on etiological classification of anemia. So classification by morphology. And classification by morphology, they are also classified under three types, the way we have seen under etiology, whereby under morphological classification of anemia, they can be either microcytic, hypochromic type of anemia, or they can be normocytic, normochromic, or they can be macrocytic, normochromic type of anemia. So we are going to discuss each in details under these headings, whereby we are going to see for microcytic means the cells are small in size, then hypochromic, the staining or the HB concentration is low. So we are going to see the size of red cell here will be less than 6 micrometer in diameter. Then the MCV, that is, which is mean cell volume, it will be less than 80 femtoliter, meaning the cell is small. Then MCH, that is mean cell hemoglobin, will also be less than 27 picograms, whereby MCH measures the amount of hemoglobin in a single red cell. Then if we want, we can add MCHC, that is the mean cell hemoglobin concentration, which measures the concentration of hemoglobin in a single red cell. And even when it is below 32, this is what we call below 32 grams per deciliter. So this is what we can see under microcytic hypochromic type of anemia. And under peripheral blood film or thin film, when this is a small resting lymphocyte, if this is a lymphocyte, we shall find that these cells are small in size. You find the red cells are small in size compared to the nucleus of the resting lymphocyte. They are small in size, and the area of central pera is bigger. They have big area of central pera. This is what we call microcytic hypochromic red cells. This is what you see under thin film, small in size with little HB content. How do we know it is small in size? By comparing with the nucleus of a small resting lymphocyte. And the causes of microcytic hypochromic type of anemia, one of the causes and the most common cause is iron deficiency. Iron deficiency, that is iron deficiency anemia. Iron deficiency is the leading cause of, so this is the most, if they ask in an exam that which of the following is the most common cause, that is iron deficiency. Then other anemias under microcytic hypochromic, we can see anemias like sideroblastic anemia. This is due to iron overload. Due to iron overload, we can see anemias of chronic diseases. Anemias of chronic diseases can also lead to microcytic hypochromic. We can also see anemias of chronic bleeding. Chronic bleeding, they can lead to this type of anemia. Then lastly, thalassemias. Thalassemias can also lead to microcytic hypochromic type of anemia. So whenever you ask to discuss any type of anemia, you have to tell us the appearance of cells, that is under morphology. Then you tell us the PBF, how we look, under thin film, how we can identify it, and then you tell us the causes. Then in upcoming videos, we shall be picking one by one, also talking about it, whereby we shall talk about iron deficiency in details and other type of anemias. The second one we can discuss is the normocytic, normochromic type of anemia. Normal means the size, normocytic means the size is normal, even the staining or the HB content is normal. So we're going to see the size of this red cell is between 6 to 8 with average of 7.2 micrometer in diameter. Then the MCV is between 80 to 100 femtoliters. Then the MCH is between 27 to 32 picograms. Then the MCHC will be between 32 to 36 grams per deciliter. This is the appearance, meaning the cells are normal in size and the HB content is normal. So when we are drawing it under thin film, we are going to find that these cells, they are the same size as the nucleus of a small resting lymphocyte. So the size is the same as the nucleus of a small resting lymphocyte. So these are normocytic, normochromic red cells with the area of central pera covering a third of the cell, meaning the HB content is sufficient. So these are normocytic, normochromic type of red cells. And the causes of this type of anemia, going to see the causes of normocytic, normochromic can be some hemolytic anemias like sickle cell. Can do this. Hemolytic anemias, we can see it in we can see this one being caused by aplastic anemia due to bone marrow failure. Aplastic anemia, we can see it in acute hemorrhage after you have got a road accident and you have acute bleeding. The type of anemia is normocytic, the cells are normal in size and HB content. Then even acute infections like bacterial or parasitic infections, we find they have normal cells which are normal in size. Then lastly, under normocytic, we can see even some anemias due to renal failure. Anemia due to renal failure. We know that the kidney is the one responsible for production of erythropoietin hormone, which triggers production of red cells. So if someone is deficient of erythropoietin due to kidney failure, they can also get a normocytic, normochromic type of anemia. Then lastly, which is number 4, we can discuss about macrocytic nomochromic. And under macrocytic, macro means cells are big in size. Then nomocytic nomochromic, meaning the HB content is normal. And under about measuring the size here, the size, it will be greater than 8 micrometer in diameter. Then the MCV shall be greater than 100 femtoliters, that is under CBC. Then MCH will be greater than 32 picograms. Then MCHC shall be greater than 36 grams per deciliter. So this is under CBC. That is how we can tell that this type of anemia is macrocytic nomochromic. But here under macrocytic nomochromic, the MCH, that is mean cell hemoglobin concentration, is normal. Is normal, that is between 32 to 36 grams per. It is not high, it is normal. Only MCV and MCH, they are high. And under a thin film exam, we are going to see that these red cells, comparing to the nucleus of a small lymphocyte, they are macro, or they are bigger. They are bigger compared to the size of a small lymphocyte. So we can see when we compare these cells together with the nucleus of this small lymphocyte, these cells are big. And some can be round, others can be oval in shape. Some can be oval in shape. So these cells and the HB content is normal. That's why we are seeing MCHC is normal. So this is the picture of macrocytic nomochromic type of anemia. And under causes, we are going to see the causes can be either megaloblastic causes, can be megaloblastic, or they can be non-megaloblastic. And under megaloblastic causes, we are going to see due to either vitamin B12 or folate deficiency, or maybe due to pernicious anemia. What is pernicious anemia? This is due to lack of intrinsic factor. Intrinsic factor is produced by the parietal cells, and it is the one that enables absorption of vitamin B12. So someone with pernicious anemia can also have a megaloblastic type, and even someone with D-latam infection or tapeworm infection can also, because this tapeworm feeds on vitamin B12, so it can at the long run lead to vitamin B12 deficiency. That is D-latam, Dibofridium latam. And here for megaloblastic anemia, the cells are megalo, greater than 12 micrometer in diameter, and they are oval in shape. So when you see it under PBF, they are oval in shape, and at a chronic stage, you will find under CBC, all cell lines will be low, what we call pancytopenia, which we shall discuss in details in the coming sessions. Then under non-megaloblastic, here the cells are round. Find the cells are round, and the non-megaloblastic causes of this, it can be either due to chronic alcoholism, it can be due to liver disease, it can be due to hypothyroidism, and sometimes some hemolytic anemias can also be due to non-megaloblastic causes of macrocytic nomochromic type of anemia. So this is what we can discuss under morphological classification of anemia. Thank you so much for following us from the beginning. where we have seen about what is anemia, we have seen about signs and symptoms, we have seen causes, and then classification, whereby we have looked at etiological classification and morphological. But in the coming video, we shall see in details etiological classification. Thank you so much for learning with us at Medical Sciences. Please remember to subscribe if you haven't subscribed. May God bless you.